Hello, I'm Dr. Sandra Cabot, and I'm joined today by Natasha Flynn, who's a herbalist and nutritionist. Now, would you like to explain to everybody the 4 different body shapes and how they differ?
Most certainly. Okay, the gynoid body type is the traditional pear-shaped body shape. They actually have a tendency towards estrogen dominance, which makes them gain weight around the hips, buttocks and thighs. They have, obviously all the body types have different metabolic and hormonal characteristics, and the gynoids particularly will find it very hard to shift the weight around their buttocks if they're not following the appropriate meal plan. So we usually would incorporate strategies to overcome estrogen dominance in a gynoid body type, for example.
Yes, that makes sense. And I've noticed over the years in doing blood tests in a lot of patients that the different body shapes have different hormonal characteristics and different levels. And you're right about the pear-shaped. They do have that estrogen dominance because the fat around the hips makes the estrogen. Now tell us about the opposite to the pear, which is the apple.
Okay, the android body shape is the traditional apple-shaped body shape. They actually have high levels of male hormones, most of the time giving them the muscle-building characteristics in the arms and legs, but a tendency towards gaining weight around the midsection of the body, around the abdomen. They have a tendency towards syndrome X, and most men are actually an android body shape, but a lot of women also have this body shape, causing them to have high levels of male hormones from all the excess visceral fat that they're carrying, and they may also have some excess facial hair or acne and other skin problems associated with the high levels of male hormones, but it also gives them quite great strength. So this body type is one that would normally be put onto a syndrome X type eating plan.
Natasha is going to tell us about the 2 other body types, lymphatic and thyroid.
The lymphatic body type, which is the one that tends to work the hardest for their weight loss, they have very sluggish lymphatic glands, so they tend to have a lot of sort of puffiness all over. You'll notice that the wrists and the ankles tend to have a lot of fluid retention, and they also have all over weight gain. So these are the ones that tend towards having a lot of weight, especially since early childhood. And then we have the opposite to that, which would be our thyroid body type, that have a very fast metabolic rate and don't tend to put weight on easily. And if they do, it tends to also be an all-over weight gain, but very, very minimal for the thyroid body type due to their genetic gift of a very fast metabolic rate.
Yes, the body types are a fascinating subject. I'm a thyroid type, so it's very hard for me to put on weight. As you can see, I've got very long, fine bone structure, very high metabolic rate. For me to put on weight, I have to make a career out of eating, which of course could be quite fun. And what I've found over the years, it's very, very important for people who are battling with a weight problem to know their body type and to know which herbs and minerals suit their metabolism best, because that will facilitate weight loss. What I also find is when I'm doing a seminar, people always want to know their body type, and they stay back for hours after the seminar finishes just for me to tell them what body type they are. Now, I bet you're curious and wondering, which body type am I? Am I an android, which is the apple? Am I a pear, which is the gynoid? Am I the tall, skinny, lanky one, which is the thyroid? Or am I the lymphatic that puts on weight all over? Well, you can send us a photo and we'll be happy to tell you, or just go to the website weightcontroldoctor.com.au and do the interactive quiz, and you'll get your answer straight away.